KLIF News and Information time is now 6:21. A young North Texas woman went blind in one eye after contracting a dangerous and rare flesh-eating bacteria.
My eye started hurting, like maybe I'd got mud or some debris in my eye. When I opened my eye, it was just like white, like the whole room was white.
According to CBS 11, Brittany Williams became infected while participating in a mud run. Health experts say it's easier than you think to contract the illness. And we have an expert on the line to help explain. Dr. Faisal Haq is an ophthalmologist and cornea specialist with Key-Whitman Eye Center in Dallas, and he joins us now live to explain. Good morning, doctor.
Good morning. Good to be here.
So this really is more, they say it's rare, but you say it's more common than you think?
Well, you know, the term flesh-eating bacteria, it typically applies to a specific infection with a bacteria known as streptococcus. And so streptococcal infections of the cornea are actually quite common. And so we see them pretty much, weekly maybe in our office. So, yes, I would say it's much more common than you might think.
Is this something that is only, I don't mean to minimize it in any way. What I'm trying to ask is does this just attack the eye, or can it cause problems with other parts of your body as well?
So, the term flesh-eating bacteria is typically reserved for a condition called necrotizing fasciitis. That's just a complicated term that basically is a deep infection underneath the skin. So the usage of this term, for an eye infection, it might not be the most appropriate term to use, but the fact is that it's the same bacteria, in this particular case, that infected the eye. Now, once it gets in the eye, it doesn't usually spread to the rest of the body, but it can spread to different parts of the eye and can cause permanent blindness if not treated in time.
So what should you do if you're running in this type of event to avoid getting this type of bacteria or doing any outside activity, I guess?
Sure. So the most important thing is if you're engaged in any kind of activity that could cause trauma to the eye, and that includes just working with your tools at home or, any kind of contact sport, wear safety goggles. Basically, any kind of trauma to the outer surface of the cornea, even minor trauma, can expose the cornea to bacteria. And once those bacteria get in through the cornea, once the protective layer has been compromised, the infection can progress pretty quickly. So safety goggles, I think, are key. And the other important point that I want to make is we see streptococcal infections and infections from other bacteria in the cornea, most commonly from contact lens wear. So any kind of activity that compromises the surface skin layer of the cornea, and the most common activity that does this is contact lens wear, predisposes us to these infections. And so we see a lot more strep infections of the cornea from contact lens wear than from any other reason. So the most important take-home message, I think, is for us to take good care of our contacts, make sure they're clean, don't sleep in them. And number two, if we're engaged in any kind of contact sport or activity that increases the risk of trauma to the eye, definitely wear safety goggles.
All right, Dr. Haq, thank you so much for talking with us this morning. Dr. Faisal Haq, an ophthalmologist and cornea specialist with Key-Whitman Eye Center in Dallas.